Today I'm going to talk to you about some cases I've had over my career of patients who have been able to holistically manage their blood pressure, specifically lower their blood pressure from hypertensive levels. I've even had some patients be able to get off of their blood pressure medication safely and under the direction of their prescribing medical doctors. Hi, I'm Dr. Lindsay Trottier. I'm a doctor of acupuncture and Chinese medicine practicing in San Diego, California, and the name of my practice is Level Acupuncture. So how does this work? Some of my patients are able to achieve these results with acupuncture, herbal medicine, or a combination of both. There are different reasons in Chinese medicine why someone's blood pressure might be higher than normal or lower than normal. But for most of the patients today, people are struggling with too high of blood pressure or hypertension. Even medications are struggling to keep their blood pressure lower, and they are constantly having to readjust their dose or change medications or layer on medications to help keep their blood pressure normal. In Chinese medicine, the systolic or top number will relate to a certain pattern, and the diastolic or bottom number will relate to a certain pattern. So as a doctor of Chinese medicine, I will look at the blood pressure, I will look at both numbers, and I will look at not just what the numbers are doing, but when the numbers go up. Is it positional? Is it stress related? Is it exercise related? Is it hydration related? Are there other organ systems involved? Some patients will describe what is called white coat syndrome. This means that they get nervous, especially in a doctor's office, and they notice that their blood pressure goes up at the doctor's office, but it's not necessarily always up, and they aren't prescribed medication, but their doctor is keeping an eye on it. Now, of course, it's great that they don't have to be on medication, but from my perspective, this is still a problem. We should be able to meet events that are potentially stressful, but not really stressful, like going to the doctor's office, without our blood pressure going all high and wacky. So patients will notice a few things. Some of my patients are on blood pressure medication, but they're being told that they have to increase their blood pressure medication, or it's not working well enough, or they're starting to also have symptoms of headaches, and they're getting sweaty, they're getting dizzy, they're getting neck tension. Now they're being referred to a cardiologist. So we will find some herbs that are going to be safe with their medication, and they are not going to interact in a negative way. Or we might also do acupuncture to help regulate their circulation system. And these patients will notice over time that their number will drop to a healthy level. Now, the thing about acupuncture is, yes, during a treatment, it can drop, and some people, it might drop too low, but with an experienced practitioner, this doesn't happen. If I am meeting with a patient, I do a very thorough medical history and evaluation, and I can often gauge if somebody is going to lean towards someone who might have their blood pressure drop too easily. I do work with a lot of patients, especially patients with chronic autoimmune, chronic fatigue syndrome, who also are noticing that their blood pressure fluctuates too high or too low. And acupuncture is really good at regulating their blood pressure along with their autonomic nervous system in general. I have patients tell me with the white coat syndrome that with the treatment and some of the tools that I will give them in their treatment plan, that they're able to go to the doctors now and not have these hypertensive short-term episodes that are related to the white coat syndrome. All in all, they're going to feel more calm. Their body is going to be more regulated. So to recap, acupuncture, herbs, a combination of both. Sometimes we use targeted supplements as well as part of the treatment plan, can help patients regulate their blood pressure, reduce hypertensive episodes, and actually bring up blood pressure for those who are experiencing too low of blood pressure for overall wellness. If this is something that you're interested in learning more about, you can schedule a free discovery call with me, Dr. Lindsay Trottier, at my office, Level Acupuncture. You can come in for a new patient treatment planning visit to look at your whole medical history, get a full examination, and talk about options in and outside of the clinic for getting you to feel the best that you can be. If you want to know more, you can go to our website, levelacupuncture.com. Thanks and have a great day.